You know, again, in our administration, when we saw bills coming in our direction that particularly were from our own party, we would let the sponsors know that that bill, if it moves forward, is headed for a veto, and try to avoid that sort of embarrassment instead of having to embarrass high priority bills from our own party. I mean, I vetoed more bills than probably any governor in Colorado history. I know I vetoed more spending than any governor in Colorado history. But there's a way to do it to where it's not unexpected, and in this case, in terms of reading, exactly,
damage to yourself.
Exactly, and in this case, on the union issue, all of these members voted for significantly greater union, and then it was vetoed, so they're on record, but the bill still didn't become law, so it probably could have been handled better.
There's some division brewing in the Democratic quarters. There's talk about trying to draft someone to challenge Ritter in a primary, and I don't think that's going to happen, but there is a challenge to Senator Bennett,
right.
A guy who both you and I have tangled with and worked
right.
with. I've got a lot of respect for him, even though I despise almost everything he stands for. Tell me a little bit about Andrew Romanoff and what kind of threat that is to Bennett. Give me
well,
from the sidelines.
My
what do you
short
think?
take would be that if you look at Ken Salazar, who was very popular, and yet Mike Miles, an unknown school teacher from Colorado Springs, top-lined him at the Democratic Convention, what was it, 4 years ago, for United States Senate. So I think Andrew Romanoff will be the top line out of the Democratic Convention next summer. That is significant in and of itself. Then that means they will run all the way through the August primary, and it could be that Senator Bennett's financial advantage will help him defeat Romanoff. What it means for those of us who are conservatives and Republicans means that for a change, the Democrats are going to have their own inter-party fight. It's probably going to move both of those candidates to the left, further from the center, which is where the general electorate typically resides.
I know it's a year off and impossible to call, but I might give this advantage to Andrew Romanoff only because I know how he works the grassroots
right.
here. I know that even though he was only a representative for the Denver area,
right.
he's worked the state. He has no wife, he has no kids.
Right.
He has been able to spend his time working those grassroots.
Right.
My guess is I think he's going to win that primary.
Well, that could be. We'll see. I mean, I think it's, again, I like to see the competition on the other side. And if we have a primary, it kind of means that we're not the only game in town. What's really hurt the Republican Party is that we've had primaries when the Democrats really didn't. And so the Beaupre-Holtzman race was inflamed because there wasn't anything else counter to it on the Democratic side. Which
blew my mind. That one I never thought. When you were running in your primary, it started
Tom
off
Norton, Chuck Berry.
Yeah,
I mean, we had
a
the
couple
Speaker,
others.
the President of the Senate.
It was amazing.
And yet it didn't go to that level. And I think that's the reason why Bob Beaupre is not governor today. I think that's the significant reason. His primary so weakened him that he was never able to recover for the general election.
Let's take it out to Washington.
Okay.
There are things going on in this country I've never seen, and I've got to tell you, I find it exhilarating to see that the middle class has woken up.
Absolutely.
That, you know, for the most part, I think the middle class, we write the $50 check to the candidate we like, and then we go back to work and make our money and pay our taxes and try to raise our kids. I'm seeing tens and thousands, and on 9/12, millions of people, even though the Washington Post called it tens of thousands, of people coming up and of middle America exercising their vocal cords. And it seems to be that health care has been the thing that really ignited it. I think this is the last line of defense. Republicans, our team, have nothing to do with this. They've got a filibuster-proof majority in the Senate. They've got plenty in the House. You know, the only thing that's stopping it is that there are some blue dogs who are scared of regular Americans. Talk to me a little bit about this, and from your point of view, I've never seen anything like this. You know, I find it exciting and scary at the same time.
I agree, because it's exciting because we're seeing our side, and I am a conservative. We're seeing our side energized like we haven't been the last 3 or 4 cycles when we were in the majority, and some made some mistakes, and certainly there's always a challenge with being in the majority, as President Bush showed. But it is exciting, but it's also frightening, because if they pass what they are trying to pass, and by they I mean President Obama and those who want to nationalize or socialize our system of health insurance and health care, it's going to be a major Huge increase in the role of the federal government. It's going to lead to trillions of dollars in deficits.
Is it
and
fair
it's going to lead us down the road.
I use those terms all the time, but I hear that they say you're not socializing it at
they're
all.
going to nationalize it and they're going to socialize it.
What makes you say so?
Well, it's because if you put in a public option, that public option will almost by definition be able to compete more efficiently against the private sector because of the tax subsidy that the public option will have. It will drive out the private health care providers, lead us with a system of national health insurance, national health care. And I say it advisedly, and I debate my friend Governor Dick Lamb at University of Denver on health care frequently, and we take opposing sides. Strongly believe that this would nationalize and socialize our system of health care.
You tried a couple things when you were governor, and some of them worked, some of them didn't. One of them that didn't work, and I wish it did, was to reduce the number of mandates here we have in Colorado.
Right.
When people are looking at health care, we have to buy right now over 50 mandates above basic insurance here, which means if you don't want to have maternity coverage,
Sure.
you have to pay for it anyway. If you don't want to have mental
actually did
care,
have some success there, but go ahead.
But you really tried to put together what was called a Chevrolet package.
And
explain it.
Just to finish your thought, what happens in healthcare is every different healthcare provider comes in and wants to put a mandate on. You have to cover this, you have to cover this, you have to cover this. Every one of those things may make some sense, but basically it increases the cost of your health insurance to where it's only a Cadillac, thus unaffordable health care plan. We tried and had some success in minimizing some of those mandates and allowing you to present a Chevrolet, thus more affordable plan. It may have been somewhat reversed in the last couple of years, but you're exactly right. Mandates lead to high and unaffordable health care coverage.
And the idea that if you don't want to pay for mental health care,
right? You don't have any history of it in your family,
smoking,
or you don't smoke. Why should you have to pay for it?
But you do in this state, and there are other states that have less. We don't have a plan that allows us, or we're not allowed to buy insurance in another state.
Right.
Now, if I wanted to go to Nebraska, and I'm sure I've got this number wrong, which they only have 12 mandates, the cost would be a lot less.
Absolutely.
I can't go there.
You should be able to, and that's one of the keys to healthcare reform is allow health insurance to be purchased across state lines so that you have more competition between everybody instead of just those who are licensed in Colorado.
You also put together a plan, and I believe it was Jay Norton who helped steer it into place, called CDAS, Consumer Directed Assistance System, something like that. And it was for Medicaid. Now, Medicaid is for poor people who can't afford health care but need it.
Right.
And this was a program that gave cash for home health care aids. And before that, if somebody who was on Medicaid, they had to go to whoever the contracted provider for the state was, and they had no choice who came. They had very little choice of when they would come, and they were really trapped inside their own homes. This thing has started to become a model for the country, and it says instead of giving Medicaid people the bureaucracy of here's who's going to come, they say here's cash, hire who you want, fire who you want, pay people more if you want or less, and you can keep the change.
Right. It really worked, and as you know, they could keep half the savings and half had to go back, so it was good for government as well. But like you and like the Independence Institute, I've always believed in choice. I believe in health savings accounts, and we pushed some of those through in our 8 years. I believe in consumer-directed care, where you get the benefit of saving some of your own dollars, some of those own tax dollars. Works very well. It works at King Soopers. It would work very well in healthcare just as well.
When you say works at King Soopers, you mean?
You have a choice of 40 different types of coffee. You can make the choice and you save the difference if you choose to go generic compared to Folgers.